How does TSH relate to postpartum thyroiditis diagnosis? Imagine your body is like a busy city, with the thyroid gland acting as a central control tower, managing your metabolism and energy levels. After giving birth, some women experience a temporary disruption in this system, known as postpartum thyroiditis. To understand how doctors diagnose this condition, we need to look at the role of a hormone called thyroid-stimulating hormone, or TSH. TSH is produced by the pituitary gland, which is like the city's control center. Its job is to tell the thyroid gland when to produce thyroid hormones, mainly thyroxine and triiodothyronine. When thyroid hormone levels are low, TSH levels go up to signal the thyroid to produce more. Conversely, if thyroid hormones are high, TSH levels drop because the body is trying to balance itself. In postpartum thyroiditis, the process is a bit more complex because it involves inflammation of the thyroid caused by the immune system attacking the gland. This inflammation can cause different phases. During the first phase, called the hyperthyroid phase, the inflamed thyroid releases too much hormone, leading to high levels of T3 and T4. Because of this excess, TSH levels are usually low, as the body senses there's enough or too much thyroid hormone and tries to slow down production. Later, the condition can switch to a hypothyroid phase, where the thyroid becomes underactive. During this time, the thyroid isn't making enough hormones, so the pituitary responds by increasing TSH levels to try to stimulate the thyroid to produce more. This rise in TSH is a key sign that the thyroid is underperforming. Monitoring TSH levels, along with measurements of free T4 and free T3, helps doctors identify which phase a woman is in. If TSH is low and thyroid hormones are high, it suggests the hyperthyroid phase. If TSH is high and thyroid hormones are low, it indicates the hypothyroid phase. This pattern helps distinguish postpartum thyroiditis from other thyroid disorders like Graves' disease or primary hypothyroidism. Doctors also use TSH testing to screen women who are at higher risk, especially those with a history of autoimmune thyroid disease or positive thyroid antibodies. Elevated TSH levels after childbirth can signal that the thyroid is not functioning properly and needs further evaluation. In summary, TSH acts as a vital marker in diagnosing postpartum thyroiditis because its levels change according to the phase of the condition. During the early hyperthyroid phase, TSH drops, and during the later hypothyroid phase, TSH rises. By carefully interpreting these levels along with symptoms and other thyroid hormone tests, healthcare providers can accurately diagnose postpartum thyroiditis, monitor recovery, and guide appropriate treatment. If you notice symptoms like fatigue, mood swings, rapid heartbeat, or weight changes after giving birth, it's important to consult a healthcare professional who can perform the right tests, including TSH, to ensure you get the care you need.